Whenever a child is working on speech sound development, in some cases they're not really aware of what their tongue and their lips can do. They haven't really been vocalizing, they haven't been babbling, because typically when children are developing, they babble as infants and then they continue to make speech sounds. So sometimes when they begin early intervention, they may be 2 years of age and they haven't been babbling. So using a mirror and different fun toys to get them to become aware of their mouths and their parents' mouths, they can start to make these speech sounds. As they're developing their vocabulary then, the speech sounds will be incorporated into words and they will attempt to speak and use speech sounds in that way.
So our daughter Noel has been in Achieva's Early Intervention program for about a year. When we first started, we didn't get a lot of eye contact. She wasn't really making any sounds. She wasn't laughing. She wasn't interacting very much. And when the therapist started coming into the home, it was a real challenge trying to figure out how we could engage with her and how we could get her to respond and pay attention to some of the things that we were trying to do with her. And they've worked so tirelessly and patiently with her. They have fun with her and they enjoy it. And we've seen so much progress, and then she has just blossomed through that.
It's been so wonderful to be a part of this family and to watch Noel develop. I noticed right away that bringing a mirror just opened her up to becoming aware of her mouth and her lips and her tongue and being willing to imitate, which is what she's working on. Her family is just so supportive in doing hand over hand to teach her how to play with her baby dolls and with other toys that she has. She's comprehending words more. She's looking at books better and starting to point to things in books.
It's been a huge blessing for our family to have them in the home and working with our daughter.
I think that any child that's in early intervention is going to benefit from the therapy that is brought to the family and how they can work with their child at home.